Closed system, uses up its energy and dies. Differentiation. Becoming specialized in structure and function. The more client can be an individual while in emotional contact with the family allows a client to think through a situation without being drawn to act by either internal or external emotional pressures. Entropy. Closed, disorganized, stagnant, using up available energy. Equifinality. Arriving at the same end from different beginnings. Homeostasis. Steady state. Input. Obtaining resources from the environment that are necessary to attain the goals of the system. Negative entropy. Exchange of energy and resources between systems that promote growth and transformation. Open system. A system with cross-boundary exchange. Output. A product of the system that exports to the environment. Subsystem. A major component of a system made up of two or more interdependent components that interact in order to attain their own purpose and the purpose of the system in which they are embedded. Suprasystem. An entity that is served by a number of component systems organized in interacting relationships. Throughput. Energy that is integrated into the system so it can be used by the system to accomplish its goals. Family theories. Equifinality. The ability of the family system to accomplish the same goal through different routes. Interdependence. Individual family members and the subsystems comprised by the family system are mutually influenced by and are mutually dependent upon one another. What happens to one family member or what one family member does influences other family members. Genograms. Diagrams of family relationships beyond a family tree, allowing a social worker and client to visualize hereditary patterns and psychological factors. Family therapy approaches. Strategic family therapy. Pretend technique. Encourage family members to pretend and encourage voluntary control of behavior. First-order changes. Superficial behavioral changes within a system that do not change the structure of the system. Second-order changes. Changes to the systematic interaction pattern so the system is reorganized and functions more effectively. Family homeostasis. Families tend to preserve familiar organization and communication patterns resistant to change. Relabeling. Changing the label attached to a person or problem from negative to positive so the situation can be perceived different. It is hoped that new responses will evolve. Paradoxical directive or instruction. Prescribe the symptomatic behavior so a client realizes he or she can control it. Uses the strength of the resistance to change in order to move the client toward goals. Structural family therapy. Bowenian family therapy. Emotional fusion. Multigenerational transmission. Stress the connection of current generations to past generations as a natural process gives the present context to history. Emotional triangle. The network of relationships among three people. Nuclear family. Most basic unit in society, and there is a concern over the degree to which emotional fusion can occur in a family system. Clients forming relationships outside of the nuclear family tend to pick mates with the same level of differentiation. Sibling position. Where a client is in birth order has an influence on how he or she related to parents and siblings. Societal regression. Manifested by problems such as the depletion of natural resources. Groups. Self-actualization occurs through release of feelings that block social performance, support from others, orientation to reality and check out own reality with others, reappraisal of self. Types of groups. Groups centered on a shared problem, counseling groups, activity groups, action groups, self-help groups, natural groups, closed versus open group, structured groups, crisis groups, reference groups. Psychodrama. treatment approach in which roles are enacted in a group context. Members recreate their problems and devote themselves to the role dilemmas of each other. Stages of group development: pre-affiliation, power and control, intimacy, differentiation, separation, termination. Pre-affiliation in the group process: development of trust. Power and control in the group process: struggles for individual autonomy and group identification. Intimacy in the group process: utilizing self in service of the group. Differentiation in the group process: acceptance of each other as distinct individuals. Separation, termination in the group process: independence. Groups held through installation of hope, universality, altruism, interpersonal learning, self-understanding and insight. Factors affecting group cohesion: group size, homogeneity, similarity of group members, participation in goal and norm setting for group, interdependence, dependent on one another for achievement of common goals, member stability. Frequent change in membership results in less cohesiveness. When a client should not be in a group: client who is in crisis, suicidal, compulsively needy for attention, actively psychotic and/or paranoid. Groupthink. Causes of groupthink: illusion of invulnerability, collective rationalization, belief in inherent morality, stereotype views of those on the out, direct pressure on dissenters, self-censorship, illusion of unanimity, self-appointed majorities. Illusion of invulnerability creates excessive optimism that encourages taking extreme risks. Collective rationalization: members discount warnings and do not reconsider their assumptions. Belief in inherent morality: members believe in the rightness of their cause and ignore the ethical or moral consequences of their decisions. Stereotype views on those on the out: negative views of the enemy make conflict seem unnecessary. Direct pressure on dissenters: members are under pressure not to express arguments against any of the group's views. Self-censorship: doubts and deviations from the perceived group consensus are not expressed. Illusion of unanimity: the majority view and judgments are assumed to be unanimous. Self-appointed mean guards: members protect the group and the leader from information that is problematic or contradictory to the group's cohesiveness, views, and/or decisions. Group polarization occurs during group decision-making when discussion strengthens a dominant point of view and results in a shift to a more extreme position than any of the members would adopt on their own. Psychodynamic theories explain the origin of the personality, emphasize unconscious motives and desires as well as the importance of childhood experiences in shaping personality. Psychoanalytic theory. Freud's levels of awareness: precocious, the conscious and the unconscious. Conscious contains all the information that a client is paying attention to at any given time. Preconscious contains all the information outside of a client's attention but readily available if needed, thoughts and feelings that can be brought into consciousness easily. Unconscious contains thoughts, feelings, desires and memories of which clients have no awareness but that influence every aspect of their day-to-day lives. 3 components of personality: id, ego, superego. Id, a reservoir of instinctual energy that contains biological urges such as impulses toward survival, sex, and aggression, unconscious and operates according to the pleasure principle, the drive to achieve pleasure and avoid pain. Ego. Egosyntonic. Behaviors in sync with the ego. The ego is comfortable with its conclusions and behaviors. Ego-dystonic. Behavior dis-sync with the ego. A client is bothered by some of his or her behaviors. Ego strength. The ability of the ego to effectively deal with the demands of the id, the superego, and reality helps maintain emotional stability and cope with internal and external stress. Superego. The moral component of personality contains all the moral standards learned from parents, and society forces the ego to conform not only to reality but also to its ideals of morality, causes clients to feel guilty when they go against society's rules. 5 stages of psychosexual development: the oral stage, the anal stage, the phallic stage, the latency stage, and the genital stage. Fixation: an inability to progress normally from one stage into another when a child becomes an adult. This concept shows up as a tendency to focus on the needs that were overgratified or overfrustrated. Oedipus complex, developed during the phallic stage, refers to a male child's sexual desire for his mother and hostility toward his father, whom he considers to be a rival for his mother's love. Castration anxiety, fear that a child's father will do something to him for desiring his mother. Alfred Adler broke away from Freud's thoughts, believed that the main motivations for human behavior are not sexual or aggressive urges but striving for perfection. Compensation, the attempt to shed normal feelings of inferiority which drives them to adapt, develop skills, and master challenges. Individual psychology. Alfred Adler, a follower of Freud and a member of his inner circle, broke away from Freud and developed his own school of thought, which he called blank. Self-psychology defines the self as a central organizing and motivating force in personality. A child's needs are met and the child develops a strong sense of selfhood. Objective is to help a client develop a greater sense of self-cohesion. 3 self-object needs. Mirroring, idealization, twinship. Twinning. Mirroring validates the child's sense of perfect self. Idealization. Child borrows strength from others and identifies with someone more capable. Twinship. Twinning. Child needs an alter ego for a sense of belonging. Ego psychology. Erik Erikson developed the stages of psychosocial development, interested in how children socialize and how this affects their sense of self. Personality develops throughout life. Identity crisis is the focal point for each stage of human development. 8 stages of psychosocial development. Trust versus mistrust, autonomy versus shame and doubt, initiative versus guilt, industry versus inferiority, identify versus role, confusion, intimacy versus isolation, generativity versus stagnation, ego integrity versus despair. Trust versus mistrust. Autonomy versus shame and doubt. Initiative versus guilt. Industry versus inferiority. Identity versus role, confusion. Intimacy versus isolation. Generativity versus stagnation. Ego integrity versus despair. Object relations theory focused on Margaret Muller's work centered on relationships with others. Lifelong relationship skills are strongly rooted in early attachments with parents, especially mothers' relationships with people or items. Margaret Muller's object relations phases. Normal autism, normal symbiotic, separation, individuation, object constancy. Normal autism. A 1-month infant is detached and self-absorbed, spends most of its time sleeping. Muller later abandoned this phase based on new findings. Normal symbiotic. 1 to 5 months, child is aware of his or her mother, but there is not a sense of individuality. The infant and mother are one and there is a barrier between them and the rest of the world. Separation, individuation. 5 to 9 months, infant ceases to be ignorant of the differentiation between him or her and the mother. Increased alertness and interest for the outside world, using the mother as a point of orientation. Object constancy. Behavioral theory. Personality is a result of interaction between the individual and the environment. Study of observable and measurable behaviors, rejecting theories that take internal thoughts and feelings into account. Goal: modify behavior. Observable behavior. A target symptoms, a problem behavior, or an environmental condition rather than on the personality of a client. Two fundamental classes of behavior: respondent and operant. Respondent: involuntary, automatically elicited by certain behavior. A stimulus elicits a response. Operant: voluntary, that is controlled by its consequences in the environment. Respondent or classical conditioning. Learning occurs as a result of pairing previously neutral stimulus with an unconditioned stimulus so that the conditioned stimulus eventually elicits the response normally elicited by the conditioned stimulus. Operant conditioning. Antecedent events of stimuli precede behaviors which, in turn, are followed by consequences. Positive reinforcement. Increased probability that behavior will occur: praising, giving tokens, etc. Negative reinforcement. Behavior increases because a negative stimulus is removed. Positive punishment. Presentation of undesirable stimulus following a behavior for the purpose of decreasing or eliminating that behavior. Negative punishment. Removal of a desirable stimulus following a behavior for the purpose of decreasing or eliminating that behavior. Aversion therapy. Any treatment aimed at reducing the attractiveness of a stimulus or a behavior by repeated pairing of it with an aversive stimulus X. Treating alcoholism with antabuse. Biofeedback. Behavior training program that teaches a person how to control certain functions such as heart rate, blood pressure, temperature, and muscular tension, often used for ADHD and panic anxiety disorder. Extinction. Withholding a reinforcer that normally follows a behavior. Behavior that fails to produce reinforcement will eventually cease. Flooding. A treatment procedure in which a client's anxiety is extinguished by prolonged real or imagined exposure to high-intensity feared stimuli. In vivo desensitization. Pairing and movement through anxiety hierarchy from least to most anxiety-provoking situation takes place in real setting. Modeling. Method of instruction that involves an individual demonstrating the behavior to be acquired by a client. Rational emotive therapy. A cognitively oriented therapy in which a social worker seeks to change a client's irrational beliefs by argument, persuasion, and rational reevaluation, and by teaching a client to counter self-defeating thinking with new, non-distressing self-statements. Shaping. Method used to train a new behavior by prompting and reinforcing successive approximations of the desired behavior. Systematic desensitization. Timeout. Removal of something desirable. Negative punishment technique. Token economy. A client receives token as reinforcement for performing specified behaviors. The tokens function as currency within the environment and can be exchanged for desired goods, services, or privileges. Jean Piaget, best known for his theory of cognitive development stages, addressed the acquisition of knowledge and how humans come to acquire it. Believes children learn through interaction with the environment. Stages of the cognitive theory: sensory motor, pre-operational, concrete operations, formal operations. Sensory motor stage of the cognitive theory. 0 to 2 years, retains image of objects, develops primitive logic in manipulating objects, begins intentional actions, play is imitative, signals meaning, infant invests meaning in event, symbol language begins in last part of stage. Pre-operational stage of cognitive theory. Concrete operations in cognitive theory. 7 to 11 years, beginnings of abstract thought, plays games with rules, cause and effect relationship understood, logical implications are understood, thinking is independent of experience, thinking is reversible, rules of logic are developed. Formal operations of cognitive theory. 11 maturity, higher level of abstraction, planning for future, thinks hypothetically, assumes adult roles and responsibilities. Lawrence Kohlberg believed that moral development parallels cognitive development. Theory holds moral reasoning with 6 identifiable stages. Kohlberg's stages of moral reasoning: pre-conventional, conventional, post-conventional. Pre-conventional stage of moral reasoning. Elementary school level child obeys an authority figure out of fear of punishment, conforms to rules to receive rewards. Conventional stage of moral reasoning. Early adolescence person acts to gain approval from others, obeys laws and fulfills obligations and duties to maintain social system. Rules are rules, avoid censure and guilt. Post-conventional stage of moral reasoning. Adult genuine interest in welfare of others, concerned with individual rights and being morally right, guided by individual principles based on broad universal ethical principles. Learning theory. Conceptual framework describing how information is absorbed, processed, and retained during learning. Pavlov and Skinner's perspective on learning theory. Behaviorists' learning is viewed through change in behavior, and the stimuli in the external environment are the locus of learning. Social workers aim to change the external environment in order to bring about desired change. Piaget's perspective on the learning theory. Cognitive learning is viewed through internal mental processes, and the locus of learning is internal cognitive structures. Social workers aim to develop opportunities to foster capacity and skills to improve learning. Maslow's perspective on learning theory. Humanistic learning is viewed as a person's activities aimed at reaching his or her full potential, and the locus of learning is in meeting cognitive and other needs. Social workers aim to develop the whole person. Bandura's perspective on learning theory. Social situational learning is obtained between people and their environment and their interactions and observations in social contexts. Social workers establish opportunities for conversation and participation to occur. Community development. An occupation, a movement, an approach, and a set of values utilized to benefit communities' place, interest, and identity. Long-term commitment. Community members working together to tackle problems enhances participatory skills of local citizens. Coercive. Power from control of punishment. Reward. Power from control of rewards. Expert. Power from superior ability or knowledge. Referent. Power from having charisma or identification with others who have power. Legitimate. Power from having legitimate authority. Informational. Power from having information. Person and environment. Highlights the importance of understanding individual behavior in light of the environment context in which a client lives and acts. Risk factors for addiction. Family, social, psychiatric, behavioral. Biopsychosocial model explanation to substance abuse. Provides the most comprehensive explanation for the complex nature of substance abuse disorders, incorporates hereditary predisposition, emotional and psychological problems, social influences, and environmental problems. Medical model explanation to substance abuse. Self-medication explanation to substance abuse. Substances relieve symptoms of a psychiatric disorder, and continued use is reinforced by relief of symptoms. Family and environment explanation to substance abuse. Explanation for substance abuse can be found in family and environmental factors such as behaviors shaped by family and peers, personality factors, physical and sexual abuse, disorganized communities, and school factors. Social model explanation to substance abuse. Substance abuse disorder. Measured on a continuum from mild to severe, each specific substance is addressed as a separate disorder. Mild substance use disorder. Requires 2-3 symptoms from a list of 11. Drug craving is added to the list, and problems with law enforcement is eliminated because of cultural considerations that make the criteria difficult to apply. Non-substance related disorders. Gambling disorder is the sole condition in a new category on behavioral addictions similar to substance-related disorders in clinical expression, brain origin, comorbidity, physiology, and treatment. Goals of treatment for substance abuse disorder. 1. Abstinence from substances. 2. Maximizing life functioning. 3. Preventing or reducing the frequency and severity of relapse. Harm reduction model. Any program, policy, or intervention that seeks to reduce or minimize the adverse health and social consequences associated with substance use without requiring a client to discontinue use. Stages of treatment for substance abuse disorder. Wernicke-Korsakoff syndrome. Disorders associated with chronic abuse of alcohol caused by thiamine vitamin deficiency resulting from the chronic consumption of alcohol. Treatment approaches to Wernicke and Korsakoff. Communication theory. Communication styles that may inhibit effective communication. Using shoulds and oughts, offering advice or solutions prematurely, judging, criticizing, and blaming, talking to a client in professional jargon, providing reassurance prematurely or without a genuine basis, ill-timed or frequent interruptions, excessive social interactions, lack of structure. Defense mechanisms. Behaviors that protect people from anxiety: automatic, involuntary, usually unconscious psychological activities to exclude unacceptable thoughts, urges, threats, and impulses. Examples of defense mechanisms. Normal behavior. Definition changes with societal standards and norms, but often viewed as good. Abnormal behavior. When people do not conform to what is perceived as normal, often seen as bad. Adult development. The changes that occur in biological, psychological, and interpersonal domains of human life from the end of adolescence until the end of life. Young adult development. Age 21 to 39 physical reaches physical and sexual maturity. Nutritional needs are for maintenance, not growth. Mental acquires new skills, information, uses these to solve problems. Social emotional seeks closeness with others, sets career goals, chooses lifestyle, community, starts own family. Key healthcare issues in young adults. Communication: be supportive and honest, respect personal values, health, encourage regular checkups, promote healthy lifestyle, inform about health risks, update immunizations, safety, provide information on hazards at home and work. Middle-age adults development. Middle-age adults key healthcare issues. Communication: keep a hopeful attitude, focus on strengths, not limitations. Health: encourage regular checkups and preventive exams, address age-related changes, monitor health risks, update immunizations. Older adults development. Ages 65 to 79 physical ages gradually, natural decline in some physical abilities. Mental continues to be an active learner thinker. Memory skills may start to decline. Social emotional takes on new roles, balances independence, dependence, reviews life. Older adults key healthcare issues. Communication: give respect, prevent isolation, encourage acceptance of aging. Health: monitor health closely, promote physical, mental, social activity, guard against depression, apathy, update immunizations. Safety: promote home safety, especially preventing falls. Elders development. Elders key health concerns. Communication: encourage the person to express feelings, thoughts, avoid despair, use humor, stay positive. Health: monitor health closely, promote self-care, ensure proper nutrition, activity level, rest, reduce stress, update immunizations. Safety: prevent injury, ensure safe living environment. Crisis. Upset to a steady state viewed as unusual, mostly negative events that tend to disrupt the normal life of a person. May not be a major event, may be the last straw. Emotional and psychological trauma. Result of extraordinarily stressful events that destroy a sense of security, making a client feel helpless and vulnerable in a dangerous world. Traumatic experience. Any situation that leaves a client feeling overwhelmed and alone, even if it does not involve physical harm. Events that may cause trauma. It happened unexpectedly, no preparation for it, feeling of having been powerless to prevent it, happened repeatedly, someone was intentionally cruel, happened in childhood, more likely to be traumatized if already under stress. Emotional and psychological symptoms of trauma. Shock, denial, disbelief, anger, irritability, mood swings, guilt, shame, self-blame, feeling sad or hopeless, confusion, difficulty concentrating, anxiety and fear, withdrawing from others, feeling disconnected or numb. physical symptoms of trauma, insomnia or nightmares, being startled easily, racing heartbeat, aches and pains, fatigue, difficulty concentrating, edginess and agitation, muscle tension. Signs of abuse: suspicious injury, somatic complaints, behavioral presentation, controlling coercive behavior. Cycle of violence: Phase I, tension building. Phase II, battering incident. Phase III, loving contrition. Batterer offers profuse apologies, assures attacks will never happen again and declares love and caring. Reasons clients stay in abusive relationships. Social exchange theory, based on the idea of totaling potential benefits and losses to determine behavior. Guidelines for interventions for domestic violence. Traditional marital couples therapy is not appropriate. Medical needs and safety needs are priorities. Trust is a major issue in establishing a therapeutic alliance. Emotional development emphasizes an increase of self-awareness and self-regulation reflected in the ability to pay attention, make transitions from one activity to another, and cooperate with others. Sexuality in infants and toddlers. Children are sexual before birth. Males have erections while still in the uterus. Infants touch their genitals because it provides pleasure. Children know their gender by age 2. Sexuality in children. Age 3 to 7 children may practice urinating in different positions, highly affectionate and enjoy hugging, may imitate adult social and sexual behaviors, play doctor and look at other children's genitals. Sexuality in pre-adolescent youth. Sexuality in adolescent youth. Age 13 to 19, increased interest in romantic and sexual relationships and in genital sex behaviors, experience strong emotional attachments to romantic partners and find it natural to express feelings within sexual relationships. Most have sexual intercourse before age 20. Adult sexuality. Aging. Scientifically defined as the accumulation of diverse deleterious changes occurring in cells and tissues with advancing age that are responsible for an increased risk of disease and death. Life expectancy, average total number of years that a human expects to live. Family life cycle. Healthy family functioning. Cognitive development. Focuses on development in terms of information processing, conceptual resources, perceptual skill, language learning, and other aspects of the brain development. Nature versus nurture. Micro-level social development. Learning how to behave and interact well with others relies on emotional development or learning how to manage feelings so they are productive and not counterproductive. Macro-level social development. Commitment that development processes need to benefit people, particularly but not only the poor, recognizes the way people interact in groups and society and the norms that facilitate such interaction. Family life cycle stages 5 to 8. Child development. Physical, mental, and socio-emotional changes that occur between birth and the end of adolescence as a child progresses from dependency to increasing autonomy. Infants and toddlers development. 0 to 3 years physical grows at a rapid rate, especially brain size. Mental learns through senses, exploring, playing, communicated by crying, babbling, then baby talks simple sentences. Social emotional seeks to build trust in others, dependent, beginning to develop a sense of self. Infant and toddlers development key concerns. Communication, provide security, physical closeness, promote healthy parent-child relationships, health, keep immunizations, checkups on schedule, provide proper nutrition, sleep, skin care, oral health, routine screenings. Age-specific care for infants and toddlers. Involve child and parents in care during feeding, diapering, and bathing. Provide safe toys and opportunities for play. Encourage child to communicate, smile, talk softly to him or her. Help parents learn about proper child care. Young children development. Ages 4 to 6 physical grows at a slower rate, improving motor skills, dresses self, toilet-trained. Mental begins to use symbols, improving memory, vivid imagination, fears, like stories. Social emotional identified with parents, becomes more independent, sensitive to others. Young children key concerns. Communication give praise, rewards, clear rules, health keep immunizations, checkups on schedule, promote healthy habits, safety promote safety habits. Age-specific care for young children. Involve parents and child in care. Let child make some food choices. Use toys and games to teach child and reduce fear. Encourage child to ask questions, play with others, and talk about feelings. Help parents teach child safety rules. Older children development. Age 7 to 12 physical growth slowly until aspertic puberty. Mental understands cause and effect. Can read, write, do math. Active, eager learner. Social emotional develops greater sense of self. Focuses on school activities. Negotiates for greater independence. Older children key concerns. Communication help child to feel competent. Useful health keep immunizations. Checkups on schedule. Give information on alcohol, tobacco, other drugs. Sexuality. Safety promotes safety habits. Older children age-specific care. Allow child to make some care decision. Build self-esteem. Ask child to help you do a task. Recognize his or her achievements and so on. Guide child in making healthy, safe lifestyle choices. Help parents talk with child about peer pressure, sexuality, alcohol, tobacco, and other drugs. Maslow's hierarchy. Physiological needs, safety needs, social needs, esteem needs, self-actualization. Definition of Maslow's needs. Adolescent development. 13 to 19 physical grows in spurts, matures physically, able to reproduce. Mental becomes an abstract thinker, chooses own values. Social emotional develops own identity, build close relationships, tries to balance peer group with family interests, concerned about appearances, challenges authority. Adolescent development key concerns. Communication provide acceptance, privacy, build teamwork, respect health, encourage regular checkups, promote sexual responsibility, advise against substance abuse, update immunizations, safety, discourage risk-taking. Age-specific care for adolescents. Treat more as an adult than child. Avoid authoritarian approaches. Show respect. Be considerate of how treatment may affect relationships. Guide 10 in making positive lifestyle choices. Encourage open communication between parents, teen, and peers. Human genetics. Autosomal dominant, autosomal recessive, and X-linked recessive. Social workers should provide counseling before and after the decision to have a genetic test. Gender role theory. Gender identity. Gender one identifies with. Gender role refers to the set of attitudes and behaviors socially expected from those with a particular gender identity. Ecological perspective. Rooted in systems theory, which views coping as a transactional process that reflects the person and environment. Disabilities. Important terms: inclusion, participation, and non-discrimination. Development. Lifelong process beginning before birth and extending to death, product of the elaborate interplay of biological, psychological, and social influences. Elizabeth Kubler-Ross developed the 5 stages of grief. 5 stages of grief: denial and isolation, anger, bargaining, depression, acceptance. Body image. The way one perceives and relates to his or her body and how one thinks he or she is seen. Positive body image factors. Negative body image. Possible effects of negative body image: emotional distress, low self-esteem, unhealthy dieting habits, anxiety, eating disorders, social withdrawal or isolation. Ethnicity refers to the idea that one is a member of a particular cultural, national, or racial group that may share culture, religion, race, language, or place of origin. Race, related to a particular social, historical, geographic context. Cultural identity. The identity of a group or culture of an individual who is influenced by his or her self-identification with that group or culture. 3-stage model for adolescent cultural and ethnic identity development. 1. Examine cultural, racial, and ethnic identity. 2. Cultural, racial, and ethnic identity search. 3. Cultural, racial, and ethnic identity achievement. Cultural identity. Stage 1. unexamined cultural, racial, and ethnic identity, lack of exploration of culture, race, and ethnicity, and cultural, racial, and ethnic differences usually in childhood. Cultural identity stage 2. Cultural, racial, and ethnic identity search, exploration and questioning of culture, race, and ethnicity in order to learn more about them and to understand the implications of belonging. Cultural identity stage 3. Cultural, racial, and ethnic identity achievement. People have a clear sense of their cultural, racial, and ethnic identity and are able to successfully navigate it in the contemporary world. Statuses of cultural identity. Strengths perspective. Based on the assumption that clients have the capacity to grow, change, and adapt, clients have important knowledge to solve problems and are the experts on their lives. They are resilient, focuses on understanding clients based on their strengths. Methods to enhance strengths. Collaboration and partnership between a social worker and client, creating opportunities for learning or displaying competencies. Environment modification. Environment is both a resource and a target of intervention. Systems theory. Closed system uses up its energy and dies. Differentiation, becoming specialized in structure and function. The more client can be an individual while in emotional contact with the family, allows a client to think through a situation without being drawn to act by either internal or external emotional pressures. Entropy, closed, disorganized, stagnant, using up available energy. Equifinality, arriving at the same end from different beginnings. Homeostasis, steady state. Input, obtaining resources from the environment that are necessary to attain the goals of the system. Negative entropy, exchange of energy and resources between systems that promote growth and transformation. Open system, a system with cross-boundary exchange. Output, a product of the system that exports to the environment. Subsystem, a major component of a system made up of two or more interdependent components that interact in order to attain their own purpose and the purpose of the system in which they are embedded. Suprasystem, an entity that is served by a number of component systems organized in interacting relationships. Throughput, energy that is integrated into the system so it can be used by the system to accomplish its goals. Family theories. Equifinality, the ability of the family system to accomplish the same goal through different routes. Interdependence, individual family members and the subsystems comprised by the family system are mutually influenced by and are mutually dependent upon one another. What happens to one family member or what one family member does influences other family members. Genograms, diagrams of family relationships beyond a family tree, allowing a social worker and client to visualize hereditary patterns and psychological factors. Family therapy approaches. Strategic family therapy. Pretend technique, encourage family members to pretend and encourage voluntary control of behavior. First-order changes, superficial behavioral changes within a system that do not change the structure of the system. Second-order changes, changes to the systematic interaction pattern so the system is reorganized and functions more effectively. Family homeostasis, families tend to preserve familiar organization and communication patterns, resistant to change. Relabeling, changing the label attached to a person or problem from negative to positive so the situation can be perceived different. It is hoped that new responses will evolve. Paradoxical directive or instruction, prescribe the symptomatic behavior so a client realizes he or she can control it, uses the strength of the resistance to change in order to move the client toward goals. Structural family therapy.